Hey everyone, this is Miss Pfeiffer, and today we're going to be talking about managing patient care when it comes to nursing leadership. The content for this lecture is going to be coming from chapter 21 of your fundamentals textbook, as well as chapter 6 of your leadership and nursing care management textbook. So let's go ahead and get started. So let's go ahead and define and differentiate leadership versus management. So, leadership is the science and skill of influencing or guiding a group of individuals towards achievement of set goals, whereas management is a guiding influence on an organization that may address human and non human problems and is exerted by many individuals through either anticipatory norm setting or situational interventions with the goal of achieving set objectives. And both of these, whether we're talking about leadership or management, is going to be essential when it comes to building a nursing team. So, what are some characteristics of effective leaders? This is a box that's straight from your textbook, but I'm going to talk to y'all a little bit more in detail about it. So, the first one is to develop interpersonal trust and ensure effective communication with individuals and teams. And we're going to talk about strategies to help promote effective communication later on in this lecture. Effective leaders need to have an awareness of personal strengths and weaknesses and allow their vulnerabilities to show. This is going to allow them to seem more approachable to their employees. So think about a time where maybe you've had a job or have had to approach someone that is in a leadership role. It's a lot easier to go to those types of people when you find them approachable versus presenting them with an issue when you don't find them approachable or you're nervous as to how they may respond to what you're telling them. Effective leaders are also going to take initiative and sustain motivation, especially during times of uncertainty. So, leaders are always going to be steady. They're going to lead their teams, and even during difficult times, their presence is going to remain steady for their employees to rely on. Effective leaders are going to seek multiple perspectives and opinions to generate options and solutions when problem solving. They're going to rebound from setbacks with positivity. So, having a good attitude is a very important quality as a leader. They need to understand what you can and cannot change, and they also need to portray that message to their staff as well. Effective leaders are going to schedule time and space to regularly reflect, recharge, and reframe. Because as we know, whether we're talking about being a leader or being a nurse, taking time away to recharge yourself and reframe your mindset is always a beneficial thing. And it's something that's important for y'all to do as you go through this program is to take time for yourself to recharge. Effective leaders are also going to take responsibility for decisions that they've made. They're going to display caring, understanding, and empathy for others. And again, that goes back to being approachable. They're also going to motivate and empower others. They're going to be their employees' cheerleader. Employees should feel as though their leaders want them to be successful in the role in which they are in. Effective leaders are going to identify need to change and support that change effectively. And then lastly, they're going to use different leadership styles, some of which we're going to talk about later appropriately. And a lot of times, the leadership style that's going to be in place is going to be dependent on the nursing team in which they are leading. So now let's talk about some of those different nursing leadership styles. The first one that we're going to talk about is transformational leadership. And these are going to be the types of leaders that are focused on change and innovation through team development. They're going to serve as a mentor for their staff, and they're going to develop and support the moral agency of the nurses in which are working on their unit. Transformational leaders create an environment that allows individuals to contribute to their fullest potential and achieve the best outcomes for patients. Servant leaders are leaders whose priority is to put the needs of others first and to promote personal growth and autonomy by ensuring their employees' highest priority needs are met. Servant leaders are often referred to as contemporary relationship based leadership style. So you may find that servant leadership is the type of leadership style that is more often in place these days. So, what are the impacts of nursing leadership when it comes to building that nursing team? Well, the first one is that an effective leader is going to foster an empowering work environment for their nurses. And an empowering work environment is going to bring out the best qualities in each and every nurse in which is employed on that unit. So, an empowering work environment when it comes to nursing is one that's going to promote autonomy, quality, and collaboration to bring out the best qualities in each and every nurse. And remember, each and every one of you have strengths and weaknesses that are going to be very different amongst each other. So the whole purpose of having an effective leader is to have someone that can identify what your strengths are and play to that to make sure that you're being the best nurse that you can be. It's also important to know that nurses that work in an empowering work environment experience lower levels of moral distress. And when it comes to building that empowering work environment, that's something that's going to begin with the nurse executive, or you may see that referred to as the CNO or Chief Nursing Officer. Effective nursing leadership is also going to be one that focuses on the best outcomes for patients. So these are going to be the leaders that are explaining to their staff what those best outcomes are so that each and every nurse and nursing assistant on that unit and other members of the interdisciplinary team are working towards that same goal to ensure the best outcomes for patients. And lastly, it's important for nursing leadership to foster effective team development. So this is going to be something that requires team building and training, trust, communication, and a workplace that facilitates collaboration and working with others. So one way of creating that empowering work environment in a healthcare setting is through the Magnet Recognition Program. And the Magnet Recognition Program's Pathway to Excellent framework is based on 5 components that help to create a positive practice environment for nurses. There are 5 components within this, and we're going to talk a little bit more about each one of them. The first one is that transformational leadership style is what's encouraged for agencies that are working with the Magnet Recognition Program. The second component is structural empowerment. Third is exemplary professional practice. 4 is new knowledge, innovation, and improvements. And 5 is empirical quality results, which is something that we'll talk to y'all about later on in this program. So don't harp too much on that. But all of these components include the American Nurses Credentialing Center, or the ANCC. So now we're going to talk about some different professional practice models when it comes to nursing leadership. So one of the traditional practice models is called team nursing. And in team nursing, care is provided by a group led by an RN. So this model encourages collaboration among nurses, licensed practical nurses or LPNs, and support staff. It also is going to foster enhanced patient care through shared responsibilities and diverse skills. So this is going to be a team of individuals working together towards that common goal of promoting the best outcomes for patients. Another traditional model is called primary nursing. And in primary nursing, one nurse is assigned to a patient throughout their entire hospital stay. So this model promotes continuity of care, individualized attention, and it helps foster a deeper nurse-patient relationship. However, it's important to know that primary nursing is not commonly utilized now due to the high cost of having an all registered nurse staffing model. So this is probably not something that you're going to see in practice or when you go out to clinicals. So we've talked about 2 traditional models. Let's talk about 2 of the more modern day models that you will more than likely see implemented at different healthcare facilities now. The first one is patient and family-centered care. And patient and family-centered care promotes mutual partnerships among the patient, their family, and the healthcare team to plan, implement, and evaluate nursing and health. And there are 4 core concepts when it comes to patient and family-centered care. And nurses are going to support and promote patient engagement and empowerment when using this model. So the whole purpose of patient and family-centered care is to help the patient and their family feel like they're engaged in their health care and are able to help make, some major medical decisions. So the first core concept of patient and family-centered care is respect and dignity. So this looks like ensuring that the care provided includes and takes into consideration the patient and their family members' knowledge, values, beliefs, and culture. Information sharing is the second concept of patient and family-centered care. And this is important that healthcare providers communicate and share timely, complete, and accurate information with patients and their families in order to allow them to effectively participate in their healthcare and the decision-making process. The third component is participation. So patients and their families should be encouraged and supported in participating in the care and decision making. And the fourth and final concept is collaboration. So it's important that healthcare leaders collaborate with patient and their family members when it comes to policy and program development, implementation of interventions, and evaluation of the interventions in which were implemented. So maybe that looks like implementing an educational program about quitting smoking, and evaluating that is whether or not that patient was able to actually quit smoking. So the other traditional model that you may see implemented now is called case management. And in case management, it helps coordinate and link healthcare services across all levels of care for patients and their families, while also streamlining cost and maintaining healthcare quality. So case management focuses on achieving patient outcomes within effective time frames and with the available resources. So typically, case managers are nurses, but they do not provide direct patient care. Instead, they're going to collaborate with the nurses and physicians that are providing direct patient care and actively coordinate discharge planning while ensuring the necessary resources and services are available. So case managers are helping this patient ultimately reach that hospital discharge date and making sure that when they are discharged, they have all the resources available to them. So what that may look like is providing them with information about a home healthcare agency or medical equipment company to make sure that if they need a wheelchair at home, they're able to have that wheelchair before they get discharged from the hospital to help, again, improve patient outcomes, not only during the hospitalization, but also once they get out of the hospital, because we don't want patients to be directly readmitted back to the hospital after discharge. So let's take a quick quiz. A travel nurse has taken an assignment at a healthcare facility where nurses assume responsibility for a caseload of patients over a period of time. This type of nursing exemplifies, y'all look at these answer choices and see what you think. So if you chose B, primary nursing, that is correct. And remember in primary nursing that occurs when one nurse assumes the responsibility of a patient throughout their stay. So now let's talk about the decision-making process and delegation. These are going to both be very important components for you to familiarize yourself with as you begin your journey in nursing school. So let's start with decision-making. So decision-making requires skilled communication, collaboration, adequate staffing, recognition, and effective leadership and management. So you can see that there's a lot of components that go into an effective decision-making process. Decentralized management is when decision-making occurs at the level of the staff, and within that decentralized management, we have shared governance. And that's the typical decentralized structure that's used within healthcare agencies today. And shared governance creates an environment in which managers and staff become more involved in making decisions to shape the identity and determine the success of a healthcare agency. And when you think about it, it makes sense to include all levels of staff in the decision-making process, because each level of staff is going to have different ideas and different input to help promote best patient outcomes. There are 4 key elements of the decision-making process, and the first one is responsibility. This refers to the duties and activities in which you are employed to perform. So an example of this is, anytime you look online at a job posting, there typically is always something titled like the position description that basically outlines what your expectations and obligations would be should you accept that position. So that goes along with the responsibility component of the decision-making process. It's to help you be aware of what the exact expectations of you are in that specific role. The second element of the decision-making process is autonomy, and this is freedom of choice and responsibility for the choices made. So with clinical autonomy, you as the nurse make independent decisions about patient care, you plan patient care within the nursing scope of practice, and you implement independent nursing interventions. So nurses have the ability to make autonomous decisions based on the presentation of the patient and based on the nursing scope of practice. The third element of decision making is authority, and this refers to the legal ability to perform a task. So nurses can use authority to determine whether or not collaboration was successful. The fourth and final element of decision making is accountability, and this refers to individuals being answerable for their actions. It involves follow-up and reflective analysis of decisions and an evaluation of their effectiveness. So as a nurse, you're not accountable for the overall outcomes of patient care, but you are accountable for what you do. So if you make a mistake, you need to be accountable and own up to that mistake, okay? But also remind yourself that you are not accountable for the overall outcome of the patient, okay? But with accountability goes along honesty. And so, like I said, be accountable for your actions and know that at the end of the day, you are accountable for what you do. So be honest. So how can a nurse manager support staff involvement throughout the decision-making process? There's a few different things that they can do. The first one is going to be establishing nursing practice through problem-solving committees or professional shared governance councils. So an example of this would be formulating an infection control committee. They can also promote interprofessional collaboration among nurses and healthcare providers. Interprofessional rounding is another way to promote staff involvement. And the key difference between interprofessional collaboration versus interprofessional rounding is that with interprofessional rounding, typically what happens is nurses, physicians, physical therapists, dietitians, really whatever member of that interdisciplinary health team is needed for that specific patient will go into that patient room together and discuss the plan of care amongst each other in front of the patient and their family to make sure that everyone is well informed in that decision-making process. Whereas with interprofessional collaboration, it really just helps facilitate accurate communication among the healthcare team, but they're not entering each patient room together. Another way is through effective staff communication. And this is often one of the greatest challenges for nurses. And effective managers are going to use a variety of different approaches to communicate effectively with their staff because everyone's different. What style of communication may work for me may not work for you. So it's important for managers and leaders to be able to use a variety of different approaches to get whatever point they're trying to make across and to make sure that staff understands the objectives and the end goal of whatever they are communicating. And the last way managers can support staff involvement is through staff education. So it's so important that nurses pursue educational opportunities and are given opportunities to continue their education. And oftentimes you will find once you start working in a hospital, you are going to be required to partake in specific training based on whatever unit you work on. And also, once you get your nursing license, you're going to have to renew that every so often. And in certain instances, you actually have to provide continuing education hours in order to renew your license. And that's typically something that's based on your primary state of residence. So now let's talk about delegation. Delegation is the process of assigning part of your responsibility to another qualified person in a specific situation. And there are 5 rights of delegation. This is a box that you need to remember, not only for this lecture, but as you go through nursing school, it's important for you to know how to delegate tasks appropriately. So let's talk about the 5 rights of delegation. The first right is the right task. So the right tasks to delegate are ones that are included in the delegatee's job description or are included in the healthcare agency's policies and procedures. Policies and procedures need to describe the expectations, limits, and the required competency training for the activity. The second right of delegation is right circumstance. So you need to consider the patient's status. The patient needs to be stable for you to delegate tasks. So if a patient has, major changes in their vital signs, that's not going to be a time where you need to delegate care to someone else. You need to be the one taking care of that patient. It's also important to note with this that the delegatee must report changes in the patient condition to the nurse. And the nurse must reassess and evaluate the situation and the appropriateness of delegation when a patient's condition changes. So ultimately, at the end of the day, that goes back to nurses being able to make autonomous decisions. So the nurses need to keep a close eye on the patient's condition to identify in what instance delegation should not take place. The third right of delegation is right person. So the licensed nurse, employer, and delegatee are all going to be responsible for ensuring that the delegatee has the knowledge and skills required to perform the activity in which is being delegated. The fourth right of delegation are right directions and communication. This is a big one. So we need to give clear, concise descriptions of the task, including the objectives, limits, and expectations. And the communication needs to be ongoing between both the nurse and the delegatee. The delegatee is going to be responsible for asking questions to clarify information. So this goes back to if you don't know, ask. Don't be scared to clarify or seek additional information if needed. The fifth right of delegation is the right supervision and evaluation. So we need to provide appropriate monitoring, evaluation, intervention is needed, and feedback. And the nurse must follow up with the delegatee at the end of the activity to evaluate patient outcomes and be available and ready to intervene when appropriate and ensure appropriate documentation. And one other thing that's important to keep in mind with delegation is this is often a situational leadership style that can occur. And so basically, a nurse, and sometimes it can even be a nurse manager, identifies based on being organized and managing their time appropriately, that they need to delegate maybe doing something like a bed bath to allow them to be able to finish their medication administration, because medication administration in most facilities is not something that a nursing assistive personnel could do. So it's being able to identify areas in which tasks need to be delegated to make sure that the nurse is staying on task and managing, their patient load appropriately. So let's talk about some tips on effective delegation. So it's going to be important to assess the knowledge and skills of the person to whom you are delegating. So one way to do this is ask those open-ended questions. An example of this would be, tell me how and where you apply a blood pressure cuff when you're taking a patient's blood pressure. This is going to allow you to be able to make sure that whoever you're delegating the task to or the delegatee understands what exactly you're asking them to do and is going to do it appropriately and correctly. You need to match tasks to the person's skill. Again, communicate clearly. Provide clear directions by describing the task, the desired outcome, and the time frame in which the tasks need to be completed. And this goes along also in communicating the assignment in understandable terms. You're not going to be typically working alongside who you're delegating a task to, which is one of the reasons why communication with them is so extremely important. So again, you need to be able to modify your communication style to understandable terms in which they're going to understand. So it may be not using, big medical terminology, but breaking it down and keeping it simple so that they understand exactly what they need to do. You always need to listen attentively, especially if they're asking questions. and provide feedback. And remember, a thank you goes a long way. And at the end of the day, whoever you're delegating a task to is helping you out. So be appreciative of the hard work that they are putting in. And if an outcome is undesirable, what you would need to do is find a private place to discuss what occurred, any miscommunication that maybe happened, and how to achieve a better outcome in the future. So we always want to work on improving processes. And so this is why it's important that if an undesirable outcome does take place, that there's the appropriate follow-up that occurs to make sure that that does not happen again. So now let's do a quick quiz. A newly graduated nurse is assigned to care for a team consisting of herself and a certified nursing assistant. When delegating skills, she needs to. Y'all look over these and let's see what you think. If you answered B, assess the knowledge of the certified nursing assistant, that is correct. And that goes along with the 5 rights of delegation, the right person. So we need to make sure that the delegatee has the skills and knowledge in place to be able to perform whatever task it is that is being delegated. Now let's talk about leadership skills that are specific for nursing students. So we have clinical care coordination, and there are several different aspects that go along with that I'm going to break down for y'all in the next slides. But then you have team communication, again, delegation. So that is something that is very important. And then lastly is knowledge building. So let's talk about all of these in a little bit more detail. The first aspect of clinical care coordination is, let's just get an overall understanding of what I mean when I say that. So in order to coordinate the clinical care of patients safely and effectively, you need to learn how to recognize and analyze your patient's assessment cues, generate solutions to patient problems, make clinical decisions, set priorities, delegate safely, gain organizational skills, use resources, manage time, and evaluate your patient outcomes. So the first kind of breakdown within clinical care coordination that I'm going to talk to y'all about is clinical judgment. So you need to learn how to use clinical judgment and make clinical decisions through application of the nursing process. And this is something that we're going to be talking to y'all about a lot coming up, is the nursing process and how to utilize this and implement it effectively. And remember, sound clinical judgment ensures therapeutic nursing care, especially when a patient condition changes. So being able to identify changes with your patient that may warrant notifying the physician or something like that. Another important aspect within clinical care coordination is priority setting. So we need to be able to learn how to determine which patient needs should be addressed first. So we have our high priority needs, and these are going to be an immediate threat to patient survival or safety. So with this, you need to think of what we call your ABCVL, which stands for airway, breathing, circulation, vital signs, and life-threatening lab results. So anything that goes along with interfering with someone's ABCVL, or with vital signs specifically, if there's a major change indicating that the patient may be declining, that is a high priority need that automatically needs to be addressed. That's the first thing that we need to do. Then you have your intermediate priority. So these are going to be your non-emergent, non-life-threatening patient problems, but they need to be addressed in a timely manner. So an example of this would be a patient that's in acute pain. We obviously don't want our patients to be in pain, but if we had 2 patients and one patient was complaining of acute pain and the other patient was complaining of difficulty breathing, we know that we need to first prioritize that patient with difficulty breathing because that is a high priority concern. Lastly, you have low priority, and these are going to be actual or potential problems that may or may not be directly related to a patient's illness or disease. So an example of this would be a type 2 diabetic that's hospitalized for a urinary tract infection. So something that's completely different than whatever chronic diseases that patient may have. And in order to help you be able to prioritize your nursing care, Evaluate and weigh each competing task by reflecting on the following 3 questions. Is this a life-threatening situation? Will this patient or another patient be endangered if this task is not done immediately? Is this task essential to patient or staff safety? And then lastly, is this task essential to the patient's plan of care? Another aspect within clinical care coordination are organizational skills. I know we've already been talking to y'all a lot about this, but you need to learn how to become both effective and efficient when providing patient care. This can be done by combining various nursing activities. And remember, a well-organized nurse will approach any procedure by having all of the necessary equipment. This goes back to when you're doing a bed bath, you're going to have all the towels, all the washcloth, the basin, the soap, and bed linens right there with you so that you are organized and ready to complete that task. Because, like I said, think about it. If you were the patient and this nurse was in the middle of the bed bath with you, and all of a sudden that nurse tells you, hold on real quick, I got to run out, I forgot to get a towel. That's really not going to instill a lot of confidence in that patient in you as their nurse. And if anything, it may hinder you being able to build that nurse patient relationship with them. So always, always, always be organized, be on task, and be prepared with any and all supplies that you may need for what you're about to do. Another component of clinical care coordination or use of resources. So you need to learn how to appropriately utilize resources that are available to you. And keep in mind, some of the best resources you have are going to be other members of the healthcare team, or while you're in nursing school, some of the best resources you're going to have is us, your nursing faculty. We're here to help you. And also remember that leaders are going to know their limitations and will either reach out to professional colleagues for guidance and support, or they're going to review the appropriate clinical resources. So this goes back to, communication. Don't be afraid to ask questions, okay? We would rather you ask them or seek out, resources that are available to you than to just assume that or take a guess and go do something. We want you to learn the right way. So use all of the resources that are available to you, okay? And that's something that even once you get out as a nurse, anything you're uncertain about, do not hesitate to ask for help or ask for clarification. So time management is also clustered within clinical care management. I know we've already talked to y'all about this as well, but we as nurses need to learn how to establish personal goals and set realistic timeframes to complete tasks. And effective time management involves learning how, where, and when to use your time. And there are 5 principles of time management, and they are goal setting, time analysis, priority setting, which we've already talked about, interruption control, so limit interruptions and distractions, and lastly, evaluation of how well you were able to manage your time. The last component of clinical care coordination that we're going to talk about is evaluation. So we need to learn how to constantly evaluate a patient's condition and progress toward an expected patient outcome or patient goal. And remember, evaluation is something that's an ongoing process, and it does not occur only at the end of an activity. So while we may have completed a bed bath on a patient, we ultimately are going to continue to monitor this patient's condition and continue to take care of them and assess them up until they are discharged. And the process of evaluation compares actual patient outcomes with expected outcomes. So was this patient, were we expecting them to be discharged within 3 days? Did that discharge in 3 days happen, or did they have to stay in the hospital longer, or did they get discharged earlier than that 3-day mark? That is very important in the evaluation process when it comes to patient outcomes. So now let's talk about team communication. And you see right here, communicate effectively. And remember, effective communication is something that may look different based on who you're communicating with. You may have to utilize a variety of different communication techniques based on who it is that you're talking to. So some strategies to improve communication among healthcare workers: introduce yourself fully, Address colleagues formally by their name. Articulate your message clearly and in full sentences. Have the client's electronic health record available when discussing client issues so that you can be prepared, because oftentimes if you're going to be calling a physician when they're on call and they're not at the hospital, if that physician asks you a question about the patient's status or disease process or labs, they're going to expect you to be able to have that information readily available. And if you don't, they may get frustrated with you. And again, that goes along with being prepared, being organized. So anytime that you're having to discuss a client issue with anyone, make sure you have that electronic health record pulled up right in front of you. You need to focus on the patient problem. Always, always, always be professional and polite. Okay. Healthcare, any job in healthcare can be stressful, but it's important that even in those sort of situations that we always are respectful of others and remain professional. We need to understand the roles and responsibilities of everyone in the healthcare team and also utilize appropriate communication tools that are in place. And an example of these are the CUS tool. And the CUS tool stands for statements that include, I am concerned, I am uncomfortable, and this is a safety issue. And then another communication tool that is often utilized in hospitals is called SBAR, which stands for Situation, Background, Assessment, and Recommendation. And I'm going to walk y'all through a quick case study that's actually in your textbook about how to utilize SBAR in the real world clinical setting. So Alex Thomas is a nurse manager on the surgery unit and administered 1 tablet of oxycodone to Miss Martin, a patient who had surgery because of ovarian cancer for postoperative pain. The nurse returns to her room to evaluate the effectiveness of the medication 30 minutes later, and the patient is tearful and states she is having severe pain and rates it as an 8 out of 10. She refuses to get up into a chair because of her pain, and Alex is going to use SBAR to contact her doctor, Dr. Taylor. So the situation component of SBAR looks like this. Dr. Taylor, this is Alex Thomas. I'm a nurse on the surgical unit and I'm caring for your patient, Miss Martin. She is stating she has severe pain. She took 1 tablet of oxycodone by mouth for pain 30 minutes ago. Background is going to look like this. Miss Martin has ovarian cancer and was admitted postoperatively following tumor debulking surgery yesterday. Her pain medicine is ordered every 6 hours as needed for pain. Then Alex is going to provide the assessment to the doctor, and it sounds like this. Miss Martin is tearful, states her pain is severe, rating it as an 8 out of 10, and does not want to sit up or move because of her pain. Her current medication order is not sufficiently managing her pain. And lastly, SBAR ends with recommendation. So Alex is going to ask the doctor, would you like to change Miss Martin's pain medication order? So that is how you can utilize SBAR in a clinical situation so that you are providing the physician or whoever you're speaking with all of the necessary information to make clinical decisions in regards to patient care. Knowledge building. So opportunities for learning occur with every patient and team member encounter. So it's important that as nurses, we always remain competent, we pursue lifelong learning, and we share that knowledge with others. So once you get out into the real world, believe it or not, there's going to come a day where you are going to have a nursing student with you. And I just ask that you remember what it felt like for you to be a nursing student and share the knowledge and clinical skills that you have with newcomers. I know that seems like a long way away, but believe it or not, it's going to be here sooner than y'all know. So just keep that in mind as you move forward in this program. And that is all that I have for y'all today. But just remember that each of us can inspire, innovate, and influence. It doesn't matter what position you hold. Each of us has a story to tell, and each of us leads in nursing. If y'all have any questions about anything that I've talked about today, please do not hesitate to send me an email, and I'll be happy to clarify anything. Thank y'all so much.